Scabs after a hair transplant. What do you need to know? Hi everyone, this is Dr. Blake Bloxham and I'm here today for Hair Restoration Tour, and we are talking about scabs or scabbing after your hair transplant. So why do scabs occur after a hair transplant? So when we do a hair transplant, we essentially injure the scalp. What your body does in response to that is it sends fluid up there. It sends a combination of its own blood products, like serum, for example, and it also sends a lot of inflammatory products up there as a result of the injury. So when the body floods this area with things like blood, serum, inflammatory products, and we've made a lot of little incisions in the top, that fluid naturally seeps out. When that fluid seeps out and gets to the surface, it hardens and turns into scabs. So that's why you get scabs after a hair transplant procedure. Now, is scabbing normal? So yes, as I described before, scabbing is normal. There's really no way to do a hair transplant procedure and make incisions in the top without some level of scabbing. So it is normal. Don't panic if you see scabbing after your hair transplant. Okay, so it's normal, but what should you do about them? So the most important thing to remember is you need to follow your clinic's post-op instructions very carefully. Certain clinics want you to be very vigorous in getting rid of those scabs. Other clinics don't want you to be as vigorous getting rid of those scabs. My personal recommendation is that you need to keep that area clean. Typically, you want to get those scabs as best you can off of there because the body's going to heal up a little bit happier without the scabbing there. Okay, so when is scabbing not normal? So we know that some level of scabbing after the procedure is normal. We know that with good washing, you can typically keep that scabbing down. When is it not normal? So in my opinion, scabbing is not normal when it falls into a few categories. Category 1, there's an excessive amount of it. It's just scabbing all over the place. The scalp is starting to look very dry, crusted, flaky. That's not normal. Another very important type of scabbing that's not normal is if you have a very large, dark scab that seems to be getting darker and darker and is maybe even rising up off the scalp a little bit. This may be a sign of something rare but very important called necrosis that we want to avoid. So if you're in one of those situations, contact your clinic immediately and let them know, hey, I think I have some scabbing that is not normal here. So can scabbing affect the results of your hair transplant? In my opinion, yes, it can. If it gets too scabby up there, the scalp's not gonna heal as well, the grafts aren't gonna be as happy, and when you do finally go to clean those scabs off, there's a greater chance of the grafts kind of becoming intertwined in the scabs and the scabs actually dislodging a graft. Follow your clinic's post-op washing instructions carefully. Try to keep that scalp clean and scab-free, and I think your transplant will do well.